It's my pleasure to report at this ASH a poster on the longer follow-up data with the Acalabrutinib in relapsed refractory mantle cell lymphoma. FDA approval for Acalabrutinib in relapsed mantle cell lymphoma was in October 2017. The manuscript published in Lancet. So at that time, the follow-up was around over 1 year, and this time we present a longer follow-up on the same population in the same study with a median follow-up of 38 months. So in terms of efficacy, the original response rate was 80%, 81% according to the Lugano criteria, with a CR based on PET-CT scan of 40%. In the 38 months of longer follow-up, the overall response rate is 74%. The CR rate is 39%. So with the longer follow-up, we want to see any safety data updates. So there's no bad side effect occurred during this longer follow-up. So the toxicity profile actually got better with the time. In terms of durability of the response, let me share with you some very impressive data. The median duration of response was 28.6 months. Okay, if the patient has a Ki-67 of less than 50%, the median duration of response was 36.7 months. For those with a Ki-67 of over 50%, the duration of response was 15.3 months. You can see the dramatic difference between the Ki-67 low and high between 36 months versus 15 months. Dramatic change. This is consistent with the Ki-67 as a prognostic factor, always with any other drugs. How about the failure-free survival after 6 months? The failure-free survival is median PFS is 22 months. So for the 22 months, for the 3 years, 36 months projected failure-free survival is 37. So after a median of 38 months follow-up, 1/3 of the patients are still on the drug. So this is very amazing. Let me talk to you about the overall survival. The overall survival data after a median follow-up of 38 months has not been reached. So this tells you how this drug has impacted the survival. And the 3-year projected overall survival is 61%. On a single Acalabrutinib monotherapy, oral therapy, with such a long follow-up, without enhanced toxicities, the projected overall survival is 61%, still alive. This is after 2 prior lines of therapy. I think the data, again, indicates the efficacy and the durability and the favorable toxicity profile of this drug.